For eye injections, you can give in the deltoid, you'll find the acromion process. You'll go down 2 fingers and insert the needle in that area right there. You can give ventrogluteal. You'll put your palm on the greater trochanter. You'll point your index finger to the anterior superior iliac spine. Then you'll move these 3 fingers to where your index finger is, moving your index finger over, creating a V. You'll inject right in that V. You can also give vastus lateralis. You'll find the greater trochanter and the lateral femoral condyle. You'll divide this area between your hands up into thirds both ways. Then you'll take the middle section and you'll inject there. For medication administration, you'll want to verify your physician's orders. You'll want to compare that with the MAR. Then you'll check your patient's name and date of birth, and you'll compare that to their wristband to verify. You'll want to gather your medication. You'll want to check the label at least 3 times and verify that with your physician's orders. You want to gather all your equipment and wash your hands. For an intradermal injection, you'll want to use a small gauge needle. So you'll have your medication. You'll confirm the label of your medication and the amount given, the dose. You'll clean the vial. You'll pull up 0.05 milliliters of air. Inject. And then draw up 0.05 milliliters of medication. You want to get rid of any air in the vial and syringe. You'll recap using the one-handed method. For subcutaneous injection, you'll want to select your syringe, confirm medication, label and dose. You'll clean the vial. Pull up 0.05 milliliters of air. Inject into the air. Pulling up 0.05 milliliters of medication. You want to get rid of any air here. And recap needle using the one-handed method. For IM injection, you'll want to check your medication. You'll give 1 milliliter of medication. Clean your vial. Pull up 1 milliliter of air. Inject. And pull up 1 milliliter of medication. You want to get rid of any air there. Recap needle using the one-handed method. You'll label these medications as you do them, and once again check your labels. For intradermal injection, you'll clean the patient's skin. You'll want to make sure that your bevel is up. You'll want to stretch the skin, inserting at a 10-degree angle. You'll want to slowly inject medication, creating a bleb. And then you'll want to dispose of the needle properly into a sharps container. For the subcutaneous injection, you'll want to clean the skin. You want to make sure your bevel's up. You'll want to pinch up the skin and insert at a 45-degree angle. Slowly pushing medication and quickly removing needle. You'll want to dispose of needle properly in a sharps container, not recapping the needle. For the IM injection, you'll want to clean the site properly. You'll want to use the Z-Track method and push the skin to one side. You want to insert at a 90-degree angle quickly, injecting medication and withdrawing. You'll put a bandage on that, then you'll dispose of the needle properly. Then you'll want to initial on the patient's MAR and sign any documents.